Welcome everyone to today's panel session and thanks for joining us. Our session today is about unlocking the power of digital mobility in healthcare to improve patient care and experience. My name is Francisca Davies. I'm the Marketing Manager of Connected Health. And joining me today are Andrew Duncan from Spectralink, Michael Dyson from SOTI, Dirk Dumortier from ALE, Alcatel-Lucent Enterprise, Victor Pizzolato from Imprivata, and our very own CEO, Ilan Rubin. I will ask our panel members to introduce themselves in a moment, but I'll quickly run through a few housekeeping items before the presentation starts. So firstly, if you have any questions during the session, I encourage you to enter these into the GoToWebinar control panel on your screen, and I'll do my best to have all this answered for you today. In the control panel, you will also find some handouts, and I will encourage you to download throughout this session. This session is recorded and the recording will be made available in the coming days via email. So with that in mind, let's kick it off. Andrew, you can start.
Excellent. Good to see everybody here. I'm glad to have the chance to talk with everybody today. My name's Andrew Duncan. I'm the Vice President of Marketing and Product Management at Spectralink. Come with a background of building rugged purpose-built devices for about 20 years now in various formats, phones, tablets, handheld computers. And looking forward to share some of our experiences, particularly from a Spectralink perspective, about mobility in healthcare.
Yes, hi Andrew, thanks for that. My name is Dirk Dumortier. I'm a Director Partnerships within Alcatel-Lucent Enterprise and also part of the healthcare core team that we have within our organization. In particular, I'm also in charge of the digital workplace for cure and care. I'm based out of Singapore and I have 40 years experience in the healthcare sector. Thanks.
Thanks, Dirk. Michael Dyson's my name. I am the Vice President of Sales and Marketing for SOTI across the Asia Pacific region and have been working in mission and business critical mobile technology for a bit over 20 years. But you're not quite your 40, Dirk, but a bit over 20, and have been working in conjunction with the Connected Health team for around 5 years and look forward to sharing some insights and hopefully hearing from a number of the guys about other capabilities and functionalities that are really relevant to the healthcare sector.
Great. So my name is Victor Pizzolato. I am the global manager for all of our mobile solutions at Imprivata. I've been in mobility for about 12 years. I've deployed mobility into very large healthcare organizations globally and have a wealth of experience and background into the do's and don'ts and challenges and why and how mobile works well in those environments. And I've worked with many of the speakers here as well because we integrate into many of the components in the mobile stack. So look forward to our discussions.
Thanks, Victor. Ilan Rubin from Wavelink. I'm the CEO, and we obviously started Connected Health about 3 years ago, and with the methodology of really driving best of breed solutions for customers and the partners we work with today. And to that end, really thank each of the people from various parts of the globe in joining us for this session and discussion. We've tried to make it relatively informal in terms of the way we'll talk through how we work through the mobility and the digital mobility transformation that's occurring in healthcare today. Testament to the work that we're doing out there, it's the landscape of hospitals is getting more and more difficult. The challenges that the hospitals are facing and healthcare is facing is growing at record pace with increased staff workload, requirement for improved efficiency and high governance and change. And really the best of breed vendors that we've provided here really roll into some great solutions that are being used in the market and field today. We've got some really bright minds sitting on this call today to be able to drive some of the conversation in terms of gathering and harnessing the experiences they have in each of the sectors, in each of the parts of the world, to be able to drive much better efficiency And as we look at what we've done in Australia so far, the idea of today is to give you a snippet of some of the things that actually happen. What actually occurs in a hospital? What are the considerations that need to be taken into account when considering digital transformation and having mobility as the cornerstone to be able to drive that? In essence, if we look at the first element around the smartphone and what the purpose-built devices look like, these have now become pretty indispensable. The uptake of mobility within healthcare has been long, but the smart device has probably been a short period of time. The lighthouse account that we've got using the technology that we started the foray around the connected health piece is ACT Health, who actually use each of the pieces of each of the vendors that sit in the room today to be able to us to reference point what that looks like. The component that's most important in all this, it's no longer just silos. It's all requiring for integrated solutions that come together to be able to provide a total workflow, and it's not just point solutions that come together. And that's the difference of what we've got within the room today, is examples of how we integrate, because the ability to bring any technology into a hospital environment, you need to be able to integrate into what you have and what you also don't know coming down in the future through a platform that enables us to occur. And that's what you'll see as part of the conversation that we'll have with the team that will really drive that discussion. So if we look at, for example, in the first instance, a smart device, what else do we need to work with? What does clinical mobility look like? How does it come together? How does it integrate with building management systems and alarms and alerts? And that's where we have both SpectraLink and ALE, who give us great insights into the smart phones and the network solutions. Then you have to flow into what does it look like for identification of the user, single sign-on. How does that transpose? It's not about signing into the device. How do you bring down the credentials? How do you drive the conversation that goes beyond, I've just signed in and the user the device knows it's me, but how do you have the applications that the users are putting in the hands of the users to drive that ability component? And then more importantly, how do you manage the environment? So we've got SOTI, Mike Dyson from SOTI to talk through the mobile device management. It's not only just the management, it's also the supportability of the devices once in the user's hands. And how do you actually make this all simple? How do you actually make it seamless to the user to bring in very different use cases, whether it includes such things as the EMR, the critical alerts, the duress, specific jobs, and the collaboration tools to be able to do that. So throughout the discussion, we'll talk through technology, but underneath all this is reality. We've actually delivered this to customers today. And that's what's making the massive difference. And obviously we're going to impart as much as possible to the audience to be able to understand what that looks like. So that's enough for me talking too much. We'll start the conversation around what that looks like and how it comes together. And I suppose, Andrew, probably we'll start with you from a mobility perspective in terms of how you see that broad adoption of mobility, especially North America's probably been ahead of Australia in terms of the adoption of mobility within healthcare settings for smart devices. How do you see that transposing, knowing that we've obviously worked with SpectraLink for a long time, and well, a little bit more for the audience side, that Andrew has spent quite a bit of time in Australia, especially before the launch of the smart device, to garner what the users are looking for in Australia as part of the development of the technology that SpectraLink have out there today.
Yeah, absolutely. Thanks, Alon. I think, from my perspective, SpectraLink's big focus area is healthcare. It's our primary vertical. It's well over 70% of the company revenue, and it is a huge space for us to make sure that we deliver what users need in healthcare. As Alon mentioned, as we kicked off our Versity product line, spent a significant amount of time coming to Australia, working with hospitals here, working with hospitals across Europe and across North America, sitting down talking to the end user customers about what did they want to see in a purpose-built device? How does that purpose-built device come together? What are the great characteristics they want to see? And what for other devices, stuff that they've used in the past, what didn't they like? So the feedback was very broad. Obviously, when we talked to the IT staff at the hospital, they want the device to be rugged. It's got to withstand drops. It has to be waterproof. It needs to stand up to hospital grade cleansers in order to make sure that no diseases are transmitted from patient to patient. So huge focus on durability and ruggedization. That being said, it was counter to what we heard from the nursing staff that actually have to carry these devices around. They wanted devices that were slim and sleek, that they could stick in a pocket, that wouldn't tug their scrubs open when they were talking to a patient. They wanted something that was easy to use, that was intuitive, that gave them a more consumer-like device approach. And so from that perspective, we tried to blend those as best we could. We spent a substantial amount of time going after challenges to make the device super thin, but also be rugged. And so, super proud of the results. The Versity product line has grown over the years. We've got multiple products. We've got more in the pipeline that'll be coming. And those products for us really help tell the story of the foundation of healthcare, foundation of nursing, being a tool that the end user, the nurse, is willing to carry around and use, and can do it without a second thought to all of these other elements, right? We have to do background integration testing, make sure that MDM software, mobile device management from partners like SOTI, that we're able to get deployed, get on the network, and use this very well. Partners like Alcatel-Lucent make sure that we have preferred settings well understood. It's very important for our devices. We really consider our devices to be phones, and we focus on voice quality. In order to focus on voice quality as you move about in a building, the device has to roam from access point to access point, and that roaming has to happen seamlessly and in the background. If you're dropping packets, that can either terminate a call, worst case scenario, or you can just drop packets and you'll miss part of the conversation. And in a healthcare organization, missing part of the conversation could have very poor results. If somebody's trying to convey to a nurse the proper dosing for a patient and they don't hear the right dose because packets dropped, that's a very poor result. So you want to make sure that the device does the right things. Partners like Imprivata help us with the single sign-on and login, making it easier. If you're a nurse, imagine your workload of having to pick up a mobile device and type in there your password in every single room that you go into all day long, that you go into, out of. If you put the device down for a minute, you pick it up again, you got to retype it in. Having the integration and doing the work in advance with Imprivata just gives the customers confidence that they know these solutions work out of the box and that the device is really fit for purpose. And that's the key here.
Yes, as we look at the mobility component, I suppose part of the discussion is that's great because once again, the mobile device in terms of fitness for purpose gives you one element, but ultimately you're looking at the applications that sit on top of it and then how it integrates back into the network. So good understand from Dirk the things that you're seeing and how ALE is solving that component, and the work that we've done in terms of taking elements of what is, for example, the red button on a device to be able to do workflows and setting up different use cases based on the applications required by the customer.
Yeah, thanks for that question, Ellen. And first, I want to, in fact, build a little bit on top of what Andrew was saying. We have had, in fact, SpectraLink devices for multiple years in our catalog as an OEM device even, just to stretch how important it is to have a device who understands voice and voice quality. And that has been fundamental in one of our selection criteria of selecting the device as well. On top of that, yes, it is connected to the Wi-Fi, and it is also an important aspect. Although we work with any Wi-Fi network, that doesn't matter, but we do have as our own Wi-Fi, let me say, products as well. It is, when you look into a hospital, extremely important that you indeed have full coverage. The best, let me say, feedback we got from the healthcare professionals was that they were even not aware that there was a network in behind, that there was a network even running, because they need constant connectivity. They need connectivity in elevators, they need connectivity in staircases, they need connectivity everywhere. You cannot miss it. Another element that was not really mentioned, but the same device, and SpectraLink is doing that, need to be able to get the notion of where it is. And that's where the understanding location services, having that information as well on the phone is absolutely helping. And that brings me to the second part of the answer and the question of Elon, in fact. Yes, if you have a phone, yes, you have specific requirements. And one of the requirements is, of course, linked to staff duress. One of the many, let me say, mental elements that we need to help, because the staff is under extreme pressure. The last thing you want them to worry about is their personal safety. It's a pity to see, and it's a reality, in fact, that more and more staff members are attacked by patients. Just a month and a half ago, there was a French nurse who was, in fact, killed during her job. So you can imagine these are not things to take lightly. And yet, so when you come back, having a device who has even that little but very important life-saving aspect available on the device, and as you can see on top of the device, is really helping them to feel good, or at least to feel less anxious if they need to work in lonely places or during night shifts, and so on and so on.
So as we step through, I guess, the network and some of the applications, part of the conversation is always how we impact the workflow as part of the conversation. So it'd be good to get a lens from Victor, the work that Imprivata's doing, who obviously been well known for doing the desktop and what that looks like. But as the world is transposing to mobile outside the four walls, it's happening now within the four walls of healthcare, especially in Australia. It's probably a little bit less mature than other North American market. The impact of the work that and the solutions that Imprivata provide that enable the workflow to really kick in, so that staff is able to spend more time front-facing patients instead of worrying about their passwords and documentation.
Right. Yeah. So Elon, thank you. And that was a great intro. So Imprivata obviously has been around for 20 years. We are the tap and go solution that's used on desktops, as Elon had mentioned. But just keep in mind that all the speakers that you're listening to here all kind of integrate. We're kind of the central point of the clinical workflow, right? So the clinician doesn't see a lot of the pieces in the background. They don't see the MDM. They don't see the Wi-Fi network. They don't see, they see the devices, but they just expect them to work. And you need to have a solution on those devices that make it very simple and easy, right, for clinicians to do their job. You need to adhere to data privacy, you need to adhere to data security, and you need to make those devices manageable and simple to use and available all the time, right? And we're kind of the central point, but we really rely on everyone that's speaking here today to ensure that that's the foundation. If all those pieces are in place, our solution works very well. If you have challenges with some of those pieces, you're going to have difficulties in your mobile program. So the objective is, this is the reason why we're kind of all together here talking about how these mobile pieces and components are very important. But from a perspective of what Imprivata does, yes, we are the tap and go solution. You take your badge that you typically use as a clinician, you walk into work and you tap it on a badge reader. Today, for the last 20 years, we've been able to unlock that device, start up a session, allow simple authentication and single sign-on into the applications that are sitting on those devices. We've now implemented mobile, right, as an extension to what you do on desktops. Why? Because that's the trend. That's where things are moving to. People want to pick up a mobile device and have that flexibility to be able to go out and round patients without having to come back to some sort of PC to enter into the PC all those vital information components, right? So what we've done is now we've extended what you've done on desktop to mobile. And it does allow us, and here's a SpectraLink device, right, that's locked up, but we're allowing you to take the same badge that you use on the desktop and tap on a mobile device and allow you to, one, look you up as a user, authenticate you, use single sign-on to allow you to access those applications and to do it in a very secure manner that addresses your data privacy, your data security requirements, but ultimately to make it simple and quick for the clinicians to be able to get into those devices, get into the applications and start working, right? Some of the things that you'll probably hear during these discussions is what happens, what if, device doesn't work, network goes, it's all the things that we're doing together as a combined comprehensive solution is what's making it easy for you to implement mobile into your environments. But it does require discussion, right? And an understanding of how these pieces all fit together. So you do have a proper mobile program to support what Improvator provides very simply, right? That sits on top of all these different mobile components that you need to address.
Yeah, yeah, I think you hit the mark beautifully to open the segue for Mike to have a quick chat around. It's once you've signed into the device, the ability to then have the right profiles, management, security within the device. Obviously, that's where SOTI fits in, because the device in its own right only does the one thing. You then need to do a whole lot of other components to for this to be effective. When you hear about mobile device management, sometimes it's simplified, it's complex, and the way what we call a hospital provision device is very different to a BYOD device, where you need to integrate into specific applications specific to the user, and that's where SOTI obviously spend a bit of time. So it'd be great to get your lens, not only what you see within a healthcare environment, but also what's transposed in other verticals that actually is now moving into healthcare.
Yeah, thanks, Ilan. And everybody has said the same thing, but we're all big pieces or pieces of a very big puzzle. And to have a really eloquent solution, you do need all of the pieces of the puzzle put together. And particularly in the healthcare environment, when you're talking about a shared device environment, being able to make devices be usable as a shared device is something that Improvator does a lot of work towards. But then having these different profiles for different user groups or different user types, that's part of what sits in the profile creation section, if you like, of the mobile device management, the SOTI One platform, and the ability to be able to ensure that people have access to exactly what they need to, where they need to, but importantly, don't have access to what they shouldn't be able to see. That's where we come in, the ability to put a device into a genuinely functional kiosk mode so that they have a limited number of, the users, the clinicians have a limited number of icons that they can access. It makes the usability very simple. It makes the security very secure. And it also means that users can have a functional way of sharing devices without great difficulties. The other big piece, of course, is that there's an enormous number of changes. The world of whether it's Android, iOS, or any other platform, the reality is to keep security up to date means that hundreds, possibly thousands of devices need to be updated on could be a monthly, could be a quarterly, could be a weekly basis. And the learnings we've had from industries who have had to make significant changes to device firmware upgrades, security patch upgrades, application upgrades, seamlessly, quietly in the background and in a scheduled manner, that's where SOTI, the SOTI One platform really comes in, because it's so much more than just the deployment of the device in the first place. It's that ongoing management and support of the device and being able to remotely control that device to be able to help any user who is having a difficulty. So they are all integrated pieces of the puzzle.
Well, obviously the remote control is quite important. I mean, what we're seeing today is many hospitals looking at what they call hospital in the home. You've got external users. So now your support doesn't limit to the inside the four walls, right? You've got to be able to address all these applications in the outside.
100%. And the conversations that we've had over time, we've just deployed all of the ambulances in New Zealand. The classic example is they've got thousands of devices in every ambulance that have all the clinical information, but none of them are inside the four walls. They're in the back of an ambulance. Connectivity is problematic in places. There's all sorts of issues that have to be dealt with into delivering healthcare into a very broad church of users, be they inside the four walls, or be they in their home, or be they at a clinic of some description. So you have to be able to have a system that's ubiquitous. It works inside the four walls on Wi-Fi, it works on cellular, and it provides the ability to have a seamless user experience, so that they don't have to change the way they behave just because they left the building. You can actually use it in the same way if you have the right management platform behind it.
Yeah, and obviously your supportability, the ability to do some of the remote control capability means that the user doesn't always have to go back to IT. The IT can actually support remotely, which is unique to the Android platform in terms of the SOTI perspective.
Absolutely, and fit for purpose. We talk about fit for purpose all the time. Andrew's devices are fit for purpose. They're built for healthcare. They're designed for healthcare. They thought about healthcare when they were building them. We manage every OS, but there are different capabilities within different OSs, and that's just the reality. So you have to look at what is a fit for purpose device and a fit for purpose solution in a broader sense in healthcare, and particularly in what I've mission and business critical technology, which has been my space for 20 odd years.
Yeah, and what you're also seeing now is the impact of the mobility, which is really the front facing to patient and the clinician overload. We've seen it with the Royal Children's Hospital in Melbourne. They've implemented full mobile within their environment for approximately 3 years on the Epic platform. That with having mobile, the statistic that is running is 26 minutes increased patient-facing time, because they can integrate straight next to the patient bed without going back to the central location. So the ability of mobile to impact staff efficiency is obviously a massive increase based on the increased workload that are occurring obviously within healthcare today. Andrew, maybe worthwhile sort of, there's a lot of change within the mobile space over the last 1 to 2 years with transposition of moving from what was uniquely a clinical device to customers various other solutions, which includes a consumer type platforms, and some of the differences and things that you see within the world that enable us to do that. And I think as critical as important is just around the hardware, the part of the ecosystem that we call the ecosystem, some of the partners we've got in the room today really drive that conversation that it's not just a device that sits in isolation. You've got to be able to integrate with a lot of different systems and platforms that exist in customers' hands. So we've got to get the lens where you're seeing that changing in the world and how you're dealing with that.
Sure. I mean, absolutely. As I mentioned, this is where SpectraLink comes from, and its history is purpose-built devices that sit in this space. When you start bringing in the notion of consumer phones, they get very attractive because the initial purpose or initial purchase point, price point up front for buying those is substantially reduced over a purpose-built device. But when you look at a longer-term ROI, those consumer devices just don't have it in the long run. There's been studies by third-party consultants that tell healthcare companies that not using a personal or a purpose-built device will increase the cost 2 to 3x over the life cycle of a device versus buying something that is purpose-built. And part of that goes to the downtime costs, right? You need to buy a device that has all these integrations in place. Before we launch a new device, we work with SOTI, make sure that our devices can be provisioned. We work with Imprivata, make sure that the single sign-on works. We work with Alcatel to make sure that the Wi-Fi roaming works and that the rest of their software packages come together. And it's not just one application, right? There's too many thoughts, particularly in North America, where the EHR drive has been so strong, and deployment of EHR solutions has really picked up and driven mobility. As we come outside of North America, where there's not necessarily EHR mandates, there's still a drive to use EHR, but potentially more importantly is the drive to other systems, alerts and alarming and location, all of these other factors that make a nurse's life and workflow come into play, right? You need to have well thought out solutions. was mentioned earlier, the red button and the notion of staff duress and how to address that within a device, how to integrate that into the dialing system, having a dialing system integrate to the chosen call server, making sure that all of that works end to end, that messaging gets through and is secure, is something that people doing mobile deployments need to think about before picking it up and making a purchase decision.
Yeah, no, it's great. I mean, it'd be good to understand also from the group, based on the experiences, the pitfalls of what you've seen where customers have gone down a certain road, whether it be the networking applications or any other use cases that we've gone down a certain road and they've had to turn back because of they haven't taken some of the considerations they've got to bring into the conversation to be able to deliver the outcome to the staff. Because what we see and what we've seen here is the old, we bought the technology and then it just sits, it doesn't get touched because a whole lot of things don't occur. It alarms too much, it's too hard, it's too cumbersome to integrate into the application. Good to get a lens as to what you're seeing and then how you're addressing that with customers today. Dirk, maybe start with you.
Okay, so that's a damn good question. And in fact, there are, you need indeed look to the use cases. We are here with all the team together, all the partners together, and together we make a solution. And the solution has a lot of capabilities. But at the end of the day, it's about improving the efficiency. It's about improving the mental well-being of the staff members. And by the way, there is a wonderful article of McKinsey and Company from this year, reimagining the nursing workload. If you look into that, what we are providing here is the base to implement this. And yes, if you look at the mental well-being in its totality, staff safety, we discussed about that. It need to be there. Then the alarming and the notification, how they call it, the fatigue from alarm fatigue that exists. It's so easy to say each alarm need to be sent to somebody. But at the end of the day, you need to have a platform, and that's what we're providing as well, is in fact a platform who is able to fine-tune the workflows, to fine-tune the event flows, so that only the person who need to receive the alerts gonna receive the alerts. So that means you reduce the amount of alerts per person, because there are more devices, and there is a hell of a lot of more devices coming in almost on a daily basis. Now, by doing that is one thing, but the alerting is just a message from there is a problem. In that message, you need to have the capabilities of helping them in solving that problem. That can be with a single button that they can immediately call. And that's why you need to have the call quality and all these kind of things. Call back immediately, is it to the patient, to your colleagues, whatever it may be, that you can open the EMR immediately for that patient, something we have done here in Singapore. There are so many elements that you can do. Do not only send a message that there is an alert, but helping and even solving it. The collaboration tools is another element that plays on top of that, because even from a mental health point of view, a health worker, in reality, from time to time, they come in very life impacting situations. I see, and that creates a lot of stress. If they lose a patient, a lot of stress. The capability of having a device in your pocket by just a simple press that they can talk to a health helper who can help in at least putting them back on their feet, having that discussion about what just happened. And having all the little tools in your pocket, it's really helping them in performing better, and at the same time even create more efficiency in your workflows, and in fact having more patient time. And for me, that's part of the equation what we are providing here. but something that is mainly overlooked when you look from a technology point of view.
Yeah, I think you're right, Dirk. I think one of the things that I see all the time is people try and take an old way of doing things and apply it to mobility, and it doesn't work. The reality is, you talk about productivity or you know, doing things more efficiently. The reality of the situation is, if people feel properly supported, they've got a device in their hand and they've got proper support to be able to, and Violan, you talked before about being able to remote control into the device, being able to have bi-directional communication with the person. I'm having a problem with this. We can bi-directionally communicate either verbally or on the screen. We can annotate on the screen. Do all of those things remotely within the remote control to help the user fix the problem quickly and go back to the task that's the most important, which is the customer care, not be buried, I was going to use another word, not be bogged down in the challenges of the technology itself. If you can fix that problem quickly, allow them to get back to their task quickly, you have to have comprehensive remote support capability. And not all MDMs, in fact, most MDMs don't have any of that. It's just not built in. And that's where SOTI's been from a really big learning curve from other industries, from dealing with people who are in transportation and logistics and retail and all of these industries where it's been a financial goal to make sure that the productivity level is high. The important part about healthcare is, yes, there's a productivity gain, but there's also actually a significant human gain and a significant gain in improving patient outcomes. That's really where the big benefit is.
While managing to do it securely as well. That's
securely. Security is obviously paramount.
Yeah.
Absolutely.
And part of it, because Victor, the conversation that we were having earlier in relation to ensuring from a governance perspective is changing, that you know who is doing what, as opposed to someone is doing something, but we don't know who it was or when it was. That's obviously where Improbata really kick in terms of that component.
Right. Yeah, so look, there's two schools of thought here. There's two audiences. You have your clinical audience and you have your IT audience. Everyone has their own different requirements, but they all have to come together and work seamlessly, right? So when we typically come in and sit down with both parts of the organization, we need to scope out a lot of important components. We are asking on the IT side, like, so what MDM are you using? Why? Because not every MDM has the same capabilities, which means that affects your clinical workflows, your authentication, your ability to determine who those users are, right? And how well that device works, right? Or devices. The same thing about devices. Which device is the best device depends on what applications you're using. So there's a lot of prerequisites and dependencies. Does the phone work, right? Do the notifications come through? Will the applications support single sign-on, right, on those devices with that platform and OS? Really key. And then I've walked into environments. I spent a month last September in Australia talking to both IT and also clinical about what are your challenges, because your challenges sometimes are slightly different than what's happening in Europe or North America and other parts of the globe, right? So what are you challenged with and how can we help you? Because the objective is to go back to our teams and discuss how we can improve or enhance what we're doing together as a comprehensive solution, right? To make things better in your region of the world. From a networking perspective, I've been in hospitals where they'd say, well, the applications don't work right in certain parts of the floor. And I'm like, well, why? Well, seems to be drop off and the applications freeze up. Well, it has to do with your network, right? So that's why when you're hearing all these different stories of all these different people that are on this call, tying all those pieces together, making sure they're working, will make Improbata work seamlessly, right, in your environment. From a governance perspective, as Ilana's mentioned, yes, we need to know, right? The privacy officers need to know who's doing what, where, and when. We have solutions that will identify who's touching a device, right? What information are they looking at, and be able to provide reports and governance around that. We have other solutions that integrate in as part of what we call our DIF, right? Our platform that allows you to have access to governance data, privacy data, the data that's being used on the mobile devices, that are being used on the desktops, who's doing what and where. But once again, without the people on this on this call and the solutions in the background working seamlessly together, our platform, right, won't work well. No. Very key.
It's interesting
And
you
one-
say, sorry, I was just going to say, just in relation to the connectivity piece too, we're finding more and more with the remote healthcare that, you know, the application's not working, the device is doing this, or the application, people blame the wrong thing. Knowing intelligent information, having true insight into what's happening on the device, it may well be that the cellular connectivity is poor in a particular area. As I said, we look after every ambulance in New Zealand. Let's not talk about the cellular connectivity across the continent of New Zealand. It's a river. But that is a real issue. And knowing that it's not, there's nothing wrong with the application, there's nothing wrong with the device. Your cellular connectivity actually is no good. Understanding that is a really important piece. And the Wi-Fi, obviously, in the hospitals, we know a lot of very thick concrete old walls don't like Wi-Fi. They cause problems. Understanding what's causing the issue helps you fix it quicker.
Yeah.
Okay, go ahead, Andrew. Go ahead.
Sorry, I was just going to say, I think that, you know, that's actually something that's changed substantially over the last probably 7 or 8 years in this space, at least from a SpectraLink perspective. It used to be that we sold phones, and when it was just a phone, we'd work with the telecom team in IT and make sure that we had a good, proper integration to the call server technology and good connection to Wi-Fi, and that was about it. And that was very straightforward. As we've moved into this world of smart devices and digital and applications, it's become more important to have all of these stakeholders, all of the elements of the solution there and tested. But the companies doing these deployments, the hospitals in particular, need to understand that's going to bring in additional stakeholders from across their organization. It's not just going to be the telecom IT staff to deploy a phone anymore. Now it's going to be the network security team and the Wi-Fi architecture team and the nursing informatics team that's going to make sure that the nurses have the right data in front of them. All of those teams are going to have to come together and make sure that they understand the requirements and what the common objective is in order to make the deployment successful.
Very, very well said, Andrew. I really like that. Now, I just wanted to add on top of Michael and yourself, and Andrew as well, having that mixture of having indeed the between the four walls, within the four walls, and outside is more and more obvious. It's not longer between the four walls. All the partners here around the table have in fact solutions covering both areas. Even if you look on what we are providing, if the phone, for example, in New Zealand, without being discreet there, when you disconnect from the cellular connectivity, our devices knows that. Our system knows that you are not longer connected. Even the user is informed automatically from, hey, I'm not longer connected. So that both parties can find already alternatives to connect themselves again in whatever way. The same for the collaboration tools. We are automatically informed, the server side is automatically informed, hey, there is a problem, not longer connected, and they will switch over. So we have so many different options there, specifically to, let me say, solve the unexpected if you talk about outside the hospitals as well. And that's why we need the four partners around the table here.
And that's the drive of connected health. And I was just going to show, for example, I asked one of our technical guys to throw me one of the devices to give a bit of an idea of what this actually looks like, what's the actual experience of true mobility. Because in a theoretical sense, we saw this through a bit of the hype through COVID in the implementation of smart device, where they rolled into one of the hospitals here in Melbourne with an EMR, and they just took what they had, put an extension label on it, and put EMR on it, and said, here's your phone, and here's your EMR. And they put a label, you know, num extension 300. Well, there was a problem that label lasted a week, because by using those red Clinell wipes, it dissipated, and they had to go again and again, as opposed to just grabbing a device like that, tapping it like that with a tag. That opens up a remote control screen, which is locked, which only has specific applications. And then if you take another user and tap it in. Does it?
Like demos almost great, mate.
What's actually transposed through mobile, it'll actually download that application. You'll see it click along. It'll actually then open up the remote control screen. You can't hear this click, but it's actually downloading a new extension number based on this user profile as well, offering that true mobility for the user to just do their job. Hence, you'll hear that noise of that's the extension download. That's unique to SpectraLink. No one else can actually do that by virtue of the SIP clients, etc., etc. That's blind to the user, much to the point. I think Dirk, you said that earlier, that they just want to be able to go and do their job. They don't want to know what's sitting underneath it in terms of the plumbing. So that reiterates all these components come together. Looks pretty simple. It's not. Hospitals are really complex. It's difficult environments to deal with so many different components and systems. We try and make it easier, and that's where the ecosystem partners we've got here. The partnerships are highly valued, and we can see that in terms of the user feedback as to what it provides back through the partners we work with. So with that aside, I think we're nearly out of time on in terms of the presentation component, Francisca, and we open the floor for some questions.
That's right. So it's been a very insightful discussion. There's one question regarding innovation. So with future developments and innovation, what can we expect in terms of the intersection of smartphones and healthcare?
Well, who wants to take that?
I can dive in.
More change. I'll go with one thing, and that is more change. The only certainty is that change will continue to happen at a rapid rate. That is the one certainty. And what that means is that you need to leave yourself as an organisation, in my view, in healthcare, you need to leave yourself open to all of the possible technologies that might be out there and the developments that are going to come. And the more you can leave yourself able to work ubiquitously across every platform, every OS, every size of device, every form factor, the more you can leave yourself open to do that, then the better your long-term result, because you don't know where the next piece of absolutely critical technology is coming from. And anyone who says they do, well, yeah, good luck. There's a lot of change happening.
I'll just add one thing to that. It's a live example. We had a conversation with one of the Imprivata team about a hospital, and they've got a desktop solution. They're about to implement EMR. And I said to the team member, do you know that they've got 400 SpectraLinks in that environment, 400 versities? And he said, I had no idea, because the people he was doing from the EMR team weren't looking at the versity yet as part of it. That's for the mobile device sign-on, because the first focus was on desktop. So that enabled the user in this particular instance to say, I've already got a platform that's supporting multiple strategies for mobile, and they didn't even know they had it.
Absolutely.
Yeah, that goes back to that need to bring that whole team together. There's so many different elements that different groups in the hospital control, and it's important to communicate across them. In terms of innovation stuff, the predicting the future is always a trick and an art form. So I don't know how far down that path I want to go, but I will say, certainly more integrations of different applications. We're seeing rising in secure messaging needs, lots more in terms of indoor beacons and locationing technologies, and seeing those technologies then flow into other applications. Being able to understand who was it that responded to an alert or an alarm, knowing how long did it take between when the alarm happened and when somebody arrived in the room, takes very precise locationing technologies and integration to all these alert and alarm systems in order to get that look and to improve performance overall. I think Alon mentioned, one hospital at least has done the deployment, and they picked up 25 minutes per nurse per shift just from deploying these technologies. I think that's the type of thing that's only going to continue as workflows continue to be optimized, as SpectraLink and our partners continue to work together to design more and more optimized solutions.
Yeah, if I may, and Andrew, you make a very good point. as part of the, let me say, core team within our organization, what we see, and that is in fact coming from feedback we get from almost all customers that we are visiting these days, is the further integration. And of course, linked to what we are providing is the integration between the collaboration tools and the notification, because they become part of almost the same solution kit. But they need to be completely aware of the location of everything. So it's really awareness that is integrated by definition in the notification and the collaboration tool, so that you know who is close by, where is that person, before you can make in fact an optimized decision who to send alerts to, who to communicate to, who is close by for code blues and all this kind of stuff. And in fact, making again the life of the user simpler and easier, not being aware at all about the technology, but the technology is helping them in being more productive. So that's what we are doing for the moment on innovation.
Sorry, Victor, you go ahead.
That's okay. No, Dirk. So I mean, completely agree with everyone. Really, an open design, understanding what you have in your environment. I mean, today we're talking about networking devices, MDM, right? And then, of course, the solutions that are used by the clinical teams to be able to support those workflows. But you know, when we walk into an environment, we have a very large business development team that talks to hundreds of application developers. We have medical devices that are being used in hospital settings. We have to be able to integrate and speak to them and do the same type of SSO. You got, you know, drug diversion that's happening in your environment. So there's a lot of moving pieces, and having those initial discussions to see what is your overall picture within your environment, your hospital, and what are the best solutions that will plug into that environment to give you the best longevity, right, long term, because you don't want to switch things. We see a lot of switching, like as an example, I picked an MDM very quickly, didn't do my due diligence, and now I have to change my MDM. Well, you don't want to do that. You want an MDM like SOTI that has the ability to do multi-OS, multiple types of devices and endpoints, because you can expand and grow with that type of solution. You're not having to migrate at some point because it has the inability to be able to expand and grow, right? So those are examples of where we need to sit down and look at this holistically. What's your bigger picture, bigger view, and how we can get the best bang for your buck, right? Long term, between all the solutions you're using and how we can extend that into the future.
Victor, just to reiterate what you've said there, and appreciate, I'll send you the check in the mail. The two things that you said that are really relevant as well from my point of view is, we're not just about having to now manage mobile devices or Windows PCs or whatever it is in the healthcare environment. Every piece of equipment connected to the network must be managed, must be secured. And the C in the Connect platform that sits behind my head is all about the printers. So all of the printers that are connected to your network are, by their very nature, a cybersecurity risk. You have to have the capacity to be able to, within one platform, manage the printers in that environment as well, be able to not only support the use of those printers and make them more functional and the productivity better, but the security piece is massive. So that's why the SOTI One platform, from my point of view, deals with the mobile device, whether it's the kiosk or the Windows PC or the Android or the iOS, but also deals with the printers. The other thing that Connect does is it allows and immediately allows you to identify everything that's connected to your network. Whether we're actually managing it or whether we're not, you can see everything that's on the network. And to a lot of people's surprise, when we've put Connect into places, they've gone, my God, we had no idea how many things were connected to our network, because this part of the business didn't talk to this part of the business, but we didn't know they were all running on our network. It's a massive security problem. So that's where the Connect, or the C part of our, comes into it, beyond just the mobile device piece. But that's why holistically as a solution, it's very good in these environments.
Now, even if I may here for a second, it's not part of this discussion here, but as an even a connectivity vendor that we are, in fact, you should all look at an extra layer of security, definitely around the cybersecurity aspects, even the Wi-Fi, the LAN, how you connect your person's devices into that network is already the first layer of security that you can implement. We are able to identify the user on the roles, whatever they are doing, put them in dedicated, segmented environments, even have application checkers on top of that. If an application does not belongs in that segment, we are cutting it down on the source. So all the kind of implementations are possible to increase again the cybersecurity capabilities of your environment. Just to add that piece, because cybersecurity is a huge element, of course, if you talk to the IT people.
Thank you. I think we can squeeze in for another question very quickly. So this is a good segue coming out of on the back of innovation. No doubt that digital health tools will evolve, and with innovation, it will be amazing things that come out of it. And of course, healthcare organizations will adopt more and more. Now, adopting new technologies and tools require also solid change management support that comes with it. Now, what are your thoughts and insights or advice that you can give from change management piece that you've definitely seen in the market, and also your organization supporting that change management to improve adoption?
Andrew's point was, I think, really valid, which was that you've got to bring all the stakeholders along on the journey. You just have to bring everybody along on the journey. And that piece is to get people to sit down and try and understand what they're trying to achieve holistically as an organisation. So it needs very C-level managers who want to actually sit down and get all of the stakeholders engaged and then come to an agreed position, which is not going to be easy. But make sure that everybody is addressed and everybody's involved. And this doesn't matter whether it's healthcare or any other industry. Stakeholder engagement at the earliest possible phase is the key to change management.
Mm-hmm. Absolutely, and I can only acknowledge that because if you talk a little bit on application level, if you talk about workflows and so on, it becomes even more important that you have indeed everybody around the table. A code blue is not something you implement because you like this way of doing it. That is a process on high level, so you need to have the stakeholders. But any change that you make, for me, it should come from the user. It needs to be a user requirement. Yes, you can talk about, look, the technology allow you to do ABC, so that they have at least a notion of what is possible, and let them come with potential proposals. And if you go through the workflows and who need to be informed and what is the ringtone or the vibration levels or the color codes that you want to use, all the kind of stuff requires, in fact, collaboration with the end user. And if you do that from the very first step, you get already these guys on board, and the change management becomes much more easier because they are the guys who, in fact, came up with the proposals. So if you go through these kind of, let me say, evolutions, for me, that's has always been the best way to achieve a good outcome.
Yep. And I just want to add to that to say the other piece from change management is the mantra of test, test, test. So I've seen one too many customers just roll wholesale changes, either in software, in devices, in workflow, across an entire organization. Much better approach. SOTI's got some great tools for this that our devices leverage to segment the users and to trial a change in a small subsegment, see how that goes, see what learnings you can get, make sure it works well, then begin a rollout plan across an organization.
Every enterprise customer we provide a test environment so that they can actually trial the change before it actually goes into the production environment and impacts in an unexpected manner. That's critical in terms of enterprise.
Yep. And then along with that is not forgetting the human factor, right? It is staff, nurses, are people that are using these devices, and it's got to come with training. If you just roll out new software and it's got a new workflow in it, if it's got a new UI, the experience is different for them. They're using these devices when they're under pressure. It's got to come with training and adoption criteria, making sure that that the user understands why the change and what they have to do differently because of the changes. And so addressing that with them is very critical to solid adoption.
Much to your point, we're seeing that as one of the biggest requirements from users, and it's a continuum of training because their staff is changing, both at IT level is changing, and things on the floor are changing. So they don't know how to use the technology just because they were trained when they bought it a year ago. You could have 20% of the team that weren't there, and then it's reliance on have they been trained accordingly, etc. That's one of the biggest things we're seeing. It's a continuum of enablement as part of that process that needs to be done.
Eline, I think we need to,
tight on.
Yeah, right on time. So if you can just wrap it up and perhaps give a quick summary.
I don't think we can do anything quickly by the looks in the way we've last hour.
I know,
but,
you love to chat.
Yeah, I think firstly, thank you everyone for jumping on this call today. Really appreciate the attendance from all parts of the globe that we've gone. I think to I think it was pretty sure it's Boston and Boulder and Singapore and Mike Dyson. I don't know where you are. You said you were in the Maldives.
I'm in Melbourne. No, mate, I'm in Melbourne.
The call. I think this is a great conversation in terms of segue for customers to consider what's in front of them and how they can handle it. And we're confident as Connected Health, we've got some unbelievably strong partnerships that can help customers achieve some very, very, very fruitful outcomes as we've seen with customers already. So thanks again. Enjoy the rest of the day, and we'll see you again soon.
Thank you.
Thank you,
Thanks, everybody.
Now, thank you. Have a good afternoon.
Bye.
Thanks.